All right, so here we are. Thank you guys for joining us today. We have Mr. Dan from Bright Health. Say hi, Dan.
Whoa. Hi.
Thanks for being with me today. I'm Justin Jacobs. I represent Health Plan Markets, and today we're going to be talking about Bright Healthcare and all the great things that they've got going on and how we can help grow the business for you. So again, I'm Justin Jacobs. I'm the owner and principal agent at Health Plan Markets. We are a full-service agency that focuses on Medicare Advantage plans, Medicare supplements. We also do individual and family plans, and also known as ACA. But we also do ancillary products such as dental, vision, and those types of things as well. So if it lives in the health arena, we do it. I got my start in the business 16 years ago, and I was just telling Dan that when I started, it was very primitive. You know, we had to carry a big bag full of books, and you know, you'd have to lug that into a client's house, and we'd do an old school piece of paper and submit it via fax machine. And those days have changed, and it's really nice to see the progress with technology to make our jobs a lot easier. And now with the advent of COVID, we really are moving into a hybrid system where we still want to be out there in the field. We still want to service our community and help our seniors, but now we can do it remotely. So it cuts down on drive time for you and the ability to service your members, you know, pretty much from anywhere in the world. So this is really great. So let's dive into our culture. This is really going to give you a good understanding of how our organization operates at Health Plan Markets. So Dan, just make sure that you've got sound on your end, but it looks good to me. I'm going to go ahead and play.
Justin, I'm not getting any sound. I don't know if Sean.
No, I don't hear anything as well. I just put that in the chat box. I can't hear anything.
Thank you,
Yeah,
Chauncey.
let me see if I can. Bear with me 1 second here. Let's see. I'm going to go ahead and replay that video. Bear with me. All right, let's try this.
How has Health Plan Markets, HPM, helped me to become a better agent? Where can I start?
Any better?
So from an agent's perspective, the reason
Yeah, it's working fine now. Thank you.
we looked at the market and we realized that there were so many agents out there that weren't getting the services that they needed.
Being a captive agent, it was a great experience. But I feel that becoming an agent with HPM has enhanced my career.
Most agents have to build their own system. And most agents out there, they didn't have a system.
Oftentimes, I think I felt like I was on an island all by myself.
It wasn't the income and flexibility that I was looking for.
So we decided to create something to meet those needs.
HPM has helped me become a better agent because now I have a better network to work with.
The one-on-one training and the tools and things that they offer.
How to keep ourselves organized, on task, training, development, a lot of things for us.
I also have more resources as well.
It's given me a lot of tools, marketing, putting me in the right position to succeed.
You don't get those anywhere else.
But now as an independent agent, it's just a whole new world that's being opened up to me.
So you have to be very organized and you have to have a lot of resources.
Some of the tools and perks that I enjoy of being here is the monthly dinners that we have for the top agents.
Last year we took a wonderful cruise to the Bahamas. That was a great time, again, with some of my colleagues that I worked with.
My cruise last year was fun.
The other perk that I really do enjoy is the CRM. It reminds me every day of a birthday that's coming up so I can call a member or send them a card. The other part that I really enjoy is having the team that Justin has here.
The perks I really like, just the environment, the culture is healthy. We have 2 offices that we can go to and get things accomplished and get things done.
You're not just an agent, your family, you work so closely together.
Here we want to help each other.
You become friends, and then friends become family.
Becoming an agent with HPM has enhanced my career. I see a brighter future now at the end.
Someone that's looking for an agency, I would definitely say to them, whether they choose Health Plan Markets or another agency, I would really look for a true partnership, somebody that's going to support you in all sorts of ways and help you train and get to the next level.
Health Plan Markets. Be independent.
But not on your own.
There we go. So thank you. Sorry for the glitch there, but glad it worked out okay. Let me go ahead and jump out of this real quick. Okay. So at Health Plan Markets, as you can see, our culture really relies heavily on teamwork. And teamwork is really what makes us work in a level that many other agencies haven't really found that piece there. But it's all about communication, not only with you as an agent, but also with our carrier partners like Dan at Bright Health. Communication and teamwork is really how the magic happens. So one thing I do want to share with you is who is HPM. It's not just me. I have an entire team behind me that helps support you in your growth as an agent with HPM. So down the road, we've got Sergio Diaz. He's our Vice President of Sales and Marketing. He has over 25 years of experience specifically in the Medicare arena. So if you have marketing ideas, lead ideas, advertising ideas, this guy's done it. So he can definitely tell you what to do and how to do it and do it for you for a lot of our top producers. We also have Victor Crumity. He's our sales manager. He's our day-to-day with technical issues and coaching. Jessica is your first stop for contracting and licensing and certification. So once you jump on board with HPM, what we do is Jessica gets notified and she starts the processing for contracting and the certification for Bright Health. Kim is our agent support. So she is proactively calling her team. So if you land on either Kim's team, Cindy's team, or our newest addition, Sam, who's not on the board yet, we will be reaching out to you to check on you to make sure that you got business cards, pull-up banners, you have enough Bright Health kits, if you need any supplies, and then also during open enrollment, she helps agents call and set up appointments with their book of business. So really, really helpful to have somebody that's on your side, kind of like a virtual assistant, if you will. Jonathan Minotti is our manager for IT, technology, and as Dan and I were saying earlier in the presentation, technology is great, but sometimes it doesn't work. So we have Jonathan, who is there 5 days a week to help you in case your iPad goes down or if you need help with an enrollment online or how to get into your broker portal. He can help with all those great things internally. Tom Ryan, he came from another very large carrier as a broker manager, and so he is your training one-on-one and development coach. So no matter where you are in your journey as an agent, you always need to have a mentor. You always need to have a coach. I have 2 or 3 of them myself that I go off of, and we work together on, how do we get to the next level. So that's what Tom does, and he's available to you. Cindy is our administration. She helps me coordinate all these great things, including this wonderful webinar that we're doing today. But she also helps with Kim on the agent support. Casey does our social media, so you can follow us on Instagram, Facebook, and get an idea of what we do on a daily basis. She does 3 or 4 posts a day now is what she's getting at, but she also helps run Facebook ads and is learning Google ads now. So social media is your game, online advertising, Casey can help. And then Nick. Nick has joined us from a large provider group, and his job is to break open doors for you so you can start getting leads from doctors' offices. So he comes from a doctor background, as do I, and so he knows how to talk the talk and walk the walk with the physicians, and that is going to help you generate relationships and leads from their patient base. So that's our team. We have a well-rounded team to help you grow, but we also need a recipe here. So what's our recipe for success? What's been our recipe for success is that personalized agent experience. We know everyone is at a different level or a different stage in their career, and so You know, if you're new to the game, tabletops and community events are probably going to be your best bet. If you've been a veteran for a long time, you're going to want to focus on your book of business and doing events and activity around that. And then somewhere in between, you might want to work more with doctors. So depending on where you are, we realize that every agent is unique, and you need to have a personalized experience and a personalized strategy. Technology. We are a technology-based organization, and as Dan will tell you later in the presentation, they also align with us on technology and, in fact, compensate our agents for using technology, which is fantastic. I love it. As you can see in the video, we have a very helpful culture. It's not just the team, but all the agents that you saw in that video have just been leaders with us. And you know, that generous approach on helping agents, whether you're a rookie or intermediary or a veteran that's stuck in a situation, all of us play a part in all of our successes. And then, of course, lastly is the appreciation. Always difficult to describe in words, but hopefully the video kind of showed you what we do for appreciation. We've got top producer dinners. We send out you know, trophies. We do cruises and trips and all that good stuff. And a lot of it's been slowed down from COVID, but those are some of the ways that we show our appreciation. This is one of two of our offices. Our main office in Orlando is on West Colonial Drive and Towers Drive. And Health Plan Markets, we've been open there since 2013. This is a retail walk-in center, but most of our staff is working out of this office. We also have another office in Jacksonville as well. I know Bright Medicare is not there yet, but we do have the ACA product up there. So if and when you have clients between both of those offices, you have basically a hub or a home base that you come to. And when I was an agent, I didn't have a place to go. An independent agent, usually, you know, you don't have an office. So having an office where you can meet clients and do trainings and meet with the team is really, really helpful and key to your success. Personal websites. So we do have a personal website that's going up for all of our agents. This will not only have a bio and your picture, name, phone number, email address, all of that on there for you, but with our new quote and enroll tool, you're going to be able to do a full compliant presentation from your website, and also a member can enroll right from the website using our new system. Our new system is called Connecture, and this will give you the ability to do a full compliant presentation, do a quote and enroll. You can send out to your members via email or even text message now, which is really awesome. And you'll be able to send out scope of appointments and the actual application. So using this tool, you can do business anywhere. So, you know, although Bright is not in Jacksonville, you know, if you have a member that's visiting family in Jacksonville, but they live here and they want to enroll with Bright, you can do that full compliant presentation over the phone as a hybrid agent and send them the application via their phone. So it's very, very easy, simple to use system that we're now implementing that is launching in April. We also track your book of business to help you grow and leverage those relationships with not only the health plans but with the physicians. So after you do an application, we have a database that I'm going to show you here in a minute, but this gives you the ability to have your book of business ready to market. So when you're ready to do a mail out or a text message blast, or you want to jump on the dialer to start, you know, doing your calls for open enrollment, this piece right here will allow you to have everything ready to go, so you're not having to add in all these different pieces and parts later on by capturing data from your paper applications. It's already in the system. And then, you know, if you're really turning on the juice, we can look and see, hey, we've got 5 sales that came in, and because of those 5 sales, I can call up Dan right away and say, hey, Dan, you know, it's towards the end of the month, you know, or halfway through the month. What can we do for this agent now that we see that we've got 5 sales on the board? And trends are huge. You know, what's your biggest lead source? Where are you putting most of your business? What's your hottest zip code? Which doctor do you sell the most of? All of these are really great trends to know and pay attention to as you do your business. And the only way to do that is through tracking your book of business. And we do all this and manage all this through a free CRM system. You'll have access to it. It is customized, and it helps manage not only your clients but your prospects You can create daily task lists and to-do lists on a daily basis. It's available. It gives you access to your clients 24 hours a day, 7 days a week. And it also gives you reminders to follow up. So, for instance, if Mrs. Jones calls you and says, hey, I'm really interested in signing up with Bright Health, but can you give me a call next week when my daughter's in town? Fantastic. You can use the CRM system to type in the date and time, and that'll pop up on your dashboard, so you'll remember that you had to call Mrs. Jones today. So great piece of software to keep you organized. But keeping that in a daily to-do list is really, really important to your success. And most importantly, notes. So once you call Mrs. Jones, you can remember the last conversations you had, you know, what plan she was on before, and all the interactions you've ever had with her, whether it's an email or a text message or a phone call. You can keep those in one organized place. But my favorite part of this is automation. And what the system allows you to do is you can get it set up to automatically send out birthday cards and thank you cards and AEP letters when the time is right for open enrollment. And this is all done automatically. So once you put in a client, all of this is set based on timers, and we send it to the mail house and it gets sent out to each one of your clients. Really, really powerful tools to help you manage your clients and not have to sit there on a Saturday and fill out 200 thank you cards or 200 Christmas cards or any of that. That's all done for you with our system. Training. I have a saying, you always have to have one foot in the classroom and the other one in the field at all times. Learners are earners. That's the way it works around here. So if you understand your products, if you know what's going on in the industry, you can make informed decisions and be smart with your book of business and be smart with your clients. So the only way to do that is training. So we have both online and live training sessions. We're starting back up. They are limited on attendance, but all of these sessions are synced because we get sessions from all over the place, whether it's carrier trainings or HPM trainings, or if we're doing special events. You can see what's going to happen throughout the week on our training calendar. So it keeps you up to date and informed on what's going on in the industry. Our Gold Key. This is a fantastic software that we set up where basically what we've done is we've captured all the digital assets and put it all at your fingertips. So you're able to access all sorts of information from either your iPad, laptop, or phone. So I've done a full compliant presentation from my phone using our Gold Key, and inside that Gold Key is oriented in folders. You open up your Bright Health folder and you have your summary of benefits and your formulary and your sales videos and your flip charts and marketing guidelines, star ratings, and even paper applications, scope of appointments. Everything is right there organized in a folder, so you don't have to dig around all over the internet from trying to find where's that summary of benefit for Bright Health. It's all organized right here in your phone, which is fantastic. So that's our Gold Key. And our Legacy program, this is brand new for health plan markets. We realized that agents didn't have an exit strategy. The good news about this business is you can do this business for as long as you want. Our oldest agent is 77 years old, and he's still out there. He runs around like he's 16 years old, selling and offering and helping the community with health insurance. However, there's going to be a day where you say, hey, you know what, I want to retire from this, or I want to pass this book of business on to my son or daughter or spouse, and there's no real way to do that. So we came up with a program called Legacy Program. So if you decide to fully retire, or like life insurance, if something did happen to you, right now the way it's set up is you would lose all of your residuals. If you didn't recertify every year, or if something happened to you where you passed away, you would lose all of your residuals and your income. And that's not really a great legacy to leave behind for your children or your spouse. So we came up with a way where essentially we would set up a program where in case something happens or when you're ready to retire, you would sell that book of business to health plan markets, and we would pay you monthly on your book of business for a period of time. So it's a fantastic program, and it gives you somewhat of a retirement plan. So at the end of your career, you have an idea of exactly what you're going to be doing. So you don't have to recertify You don't have to meet with Dan and Justin every year to recertify for Bright Health or keep up with your licensing. All of that is taken care of by Health Plan Markets, and you just sit back and collect your check every month. All right, so before I turn it over to Dan, I do want to talk about money, because that's why we're here, really. We want to make money, right? And we're lucky enough to be in an industry where we get to help people, help the community, change their lives with healthcare, and also make a great living doing it. And I really saw a change in the way that I did the business when I hit 6 figures. So that's always been a goal of mine, is to help every agent break $100,000 in lifetime renewals. So in Medicare, yesterday in our country, 10,000 people turned 65 and are now eligible for Medicare. Today, another 10,000 will turn 65. And tomorrow, another 10,000. So 30,000 people in 3 days approximately will turn 65 in this country and are looking for an agent to help them choose a Medicare Advantage plan. And luckily, you don't need to chase down 30,000 people to make a great living. All you need is 371 clients. So out of 371 clients, your renewal is $22.50. And you times that by 371, times that by 12, and you're making $100,170 a year in lifetime renewals. And what that means is even if you stop and you add no more clients and all you do is take care of your 371, you will continue to make $100,000 a year every year for as long as you recertify, or if you hang it up with our legacy program, month in and month out, every year you'll make $100,000. So they get to a point where you don't have to continue to grind and market. But is this a get-rich-quick scheme? Absolutely not. There's no way that you're going to be able to do this overnight. I've only seen one agent do it within 13 months, I think it was. But that's because he had a book of business already. And so getting to 6 figures could take about 2 years or so, depending on how hard you're going to work. Now, it's not easy. Not quick, but it's worth it. It is definitely worth it. And both Dan and I will tell you that our entire careers are built around renewals, and it is a fantastic career setting to be able to help people. And like I call the highest paid customer service industry in the world is what we do, and I absolutely love it. And this is why you want to build relationships with your clients. So with that, I'm going to go ahead and turn it over to Dan. Dan, I think you may be on mute, but I'm going to go ahead and pass you over the baton.
Am I back?
Yes, sir.
All right, fantastic.
There you go, coming your way.
That was awesome. And I'm getting some feedback. Hold on. I don't know why. Am I still coming through okay?
Yes, sir. Yep, we see your desktop.
You see the desktop, good. Well, no, that was great, Justin, and you're right. This is a great business, and the residuals and your renewals. But I'll tell you, along with that, that's why it's so important, like you said, training, knowledge is key, because the only way you're going to have that, and you're going to retain your customers, and you're going to have good renewals and a good ratio as far as not losing customers is the knowledge that you possess. You always want to be at the top of your game, and that's just to do right by your member. I mean, the member is at the top of the list, and in order for you to do right for that member, you do have to have the up-to-date training. You do have to be very knowledgeable. You have to know what plans are in the market, what's going to fit that member, because that's what it's all about at the end of the day. It's about the member, and the more knowledgeable you are, the more that member's going to want to stay with you, and that more that member's going to tell their family members and tell their friends and say, hey, listen, call up so-and-so. They know what they're doing. They've done right by me. That's how you grow your business. That's how you keep your business, because you know what? You can be the best salesman out there and you can be making 10 sales a day, but if you're just making those sales without having any value added to it, without really doing what's right for that member, they're going to be gone as fast as you got them. So that is really, really important in this business. I've been doing this a very long time. When Justin said about the faxes, back in the day with paper, that was new technology for me. So that's how far back I go. So I'll leave it at that. But no, Justin and his agency, they bring a lot of value, to the broker. It's hard to be a broker out there all by yourself. It takes a lot of self-motivation. Not only that, there's things that just by being around the agency, you're going to pick up that you probably wouldn't have even found out on your own because, that's the thing about going to the agency. That's the thing about surrounding yourself with people that are doing the same thing that you are. Maybe they heard something and all of a sudden now they're talking about it and now you're picking up on it, and that's how you kind of teach each other. You learn from each other. So the agency concept is fantastic, and I think Justin has so much to offer. I wish that was around back in the day, because like he said, the technology today is fantastic, and Justin's kind of an IT kind of guru, very tech savvy, but with that being said, I'm just going to go ahead and just, kind of give you a high-level look at Bright. I'd like to do that, and then maybe we can get into just a question and answer, little session right at the tail end, this way in case there's any direct questions that anybody may have. But let me go ahead and get started here. Let's start with our extras playbook. Now, what this is, let me get this down to a good size here so we can all see it. What this is, these are all the Advantage Bright extras that we offer with our plans, okay? So most of these, if not all of them, you're going to see them available in all our plans throughout the state of Florida. And let's start off with the dental. All our plans come with a preventive dental plan. We utilize, the vendor is Liberty Dental. It's nationwide, hundreds and hundreds of providers available in each market. And it's inclusive of the comprehensive coverage, which varies by market. What that means is basically we do have a comprehensive plan. We do have some plans in Florida that it is included. And the plans that do not have it included, the member can go ahead for a small monthly fee of anywhere between $15 to $19. They can opt to add the comprehensive dental to their plan. But all our plans come with the basic preventive dental. And the way that works is zero copays as long as you're in the network, as long as you're using Liberty Dental. It's zero copays for all your preventative, and that includes your exams, your cleanings, your fluoride X-rays. If you decide, or if the member decides to go out of network, there will be a 30% coinsurance for out of network on the preventative. And more than likely, they're going to be able to stay in. Liberty is really throughout the whole state, so they shouldn't have any issues there. The comprehensive coverage is included, like I said, on some plans, and the plans that we don't include it will be available to choose as a buy-up. No deductibles, no waiting periods for use of the benefit, nothing. $15,000 maximum, which I believe is very reasonable. It's right in line with everybody else. 30% coinsurance for fillings. This is on the comprehensive. 30% coinsurance for fillings, 50% coinsurance for other major procedures for in-network treatment. And again, that is for the comprehensive, whether it's included in the plan or they decide to buy up and get the comprehensive. Out-of-network coverage included on PPO plans, which means, that just what it says. You don't have to use the Liberty plan. You can go out of network, but of course your benefits your copays are going to go up and your coinsurance is going to go up. How they use it is pretty straightforward. They can either go directly to Liberty, go on the link to Liberty, Customized Dentist Finder, brighthealthplan.com, search, or by logging into the member hub. I recommend that the members always advise them to go right to the member hub. I think that's the best for them, instead of them, maybe winding up somewhere out there in internet land where, they think they're clicking on one thing and they end up somewhere else and it's just an ad. So I would always advise them to go through the member hub once they become a member for accessing all their benefits. Or they can call Bright Health Member Services direct. They don't have to necessarily get on their website. They can actually call direct. And again, a lot of the seniors probably prefer that. I kind of prefer it. Not that I'm calling myself a senior yet, but I do prefer, just talking instead of having to get online. The hearing benefits, routine exams and aids. Hearing benefits, the vendor is your hearing network. Over 6,000 affiliates. The key selling points here is discounts available on various name brand hearing aids, zero copay for annual hearing exams included on every Bright Health plan, zero copay for fittings and evaluations, $750 annual hearing and benefit included on most Bright Health plans. And again, this is on most, and when I get into the plans, you'll see the ones that do have it included and the ones that don't have it. Your hearing network provides hearing and options which require no out-of-pocket for the member. So basically, they can utilize these benefits. They don't have to reach into their pocket. They don't have to come up with any money. And this is how it works. They search online for the provider, your hearing network. And there's a tool within our network, within our portal, brighthealthplan.com. They can search for it in there. But again, I advise them to go to their member hub or just call member services direct, especially the first time that they're going to use it, and they'll be more than happy to help them out, walk them through the whole process. I feel that it's better for them to have somebody to talk to than it is for them to try to do it on a computer. Now, don't get me wrong, there's a lot of seniors that are very savvy on the computer, but there's still a lot of seniors out there that would prefer to hear that voice, would prefer that personal touch where they're talking to somebody and the conversation goes back and forth and they get their issues resolved. So again, either advise them to go through their member portal or just tell them go ahead and just call member services direct. Then they can set the appointment with the provider of choice, and upon the exam, member will have options of ordering the hearing online or at the provider's office. They got options there. Let's get on to the vision, routine exams, and material. The vendor for the vision is iMed. Again, over 34,000 providers, locations, and over 131,000 providers. So it's pretty significant throughout the country. Key selling points here: zero copay for annual routine eye exams included on all health plans, all Bright Health plans. Vision material included or available to be added to all Bright Health plans. Material benefits can be used every 2 years. $25 copay covers lenses and contacts up to $130, and over 10,000 frames available. I'm sure they'll find something within those 10,000 that they will like.
Oh yeah.
I can't even imagine 10,000. I don't.
Crazy.
How do you even come up? I mean, I don't know. But anyway, it's in writing.
Yeah.
Okay. How it works? Again, they're going to say that it's going to be repetitive here, but member hub or ask your member just to call member services direct, and they'll walk them through the process. Gym membership. Here's a fun one. Home fitness program. The vendor is Silver and Fit. Thousands of providers across the nation, including YMCAs, Planet Fitness, Anytime Fitness, Gold's Gym. Key selling points. Benefits included in all Bright Health plans, all of them. Free fitness center membership or in-home fitness kit options. Save on top fitness products and services through SNF. Choose healthy program. Choose. In-home fitness kit options include free Fitbit or Garmin wearable devices, free coaching available. Signing up is easy. Go to silverandfit.com to find the participating fitness centers of your area. Simply show your Bright member card at one of our enrolled fitness centers. So basically, they call, they confirm that they accept it, they show their card, and they're in. Now, one key thing, the next one's very important, is your members may change their membership location once per month. They can't change it daily, but once a month, if they feel that they're not getting what they thought they were going to get, or they're just not enjoying the area, or they just rather go to a closer place or a place that's different, they are allowed to change, but they're only allowed to make that change once a month. So that's important. That's a keynote, because some members may think that they can just walk into different ones every day, and that's not the way it works. So just be clear on that part of it, that they can choose to change their membership once a month. Over the counter, this one's a biggie for us, very big. And this is one of the three key features that I really feel that sets us aside from the majority of the carriers that are out there and that we're competing with. The OTC card, you say, oh, that's an OTC card. A lot of the carriers have an OTC card. Yeah, we have an OTC card, $250 a quarter. Yeah, some carriers have that feature. They'll go up that high. Some don't. Some are only $70. Some are only $75. But the key thing about our over-the-counter, and what makes this over-the-counter so unique, is that they can go to any dentist, to any facility that's a dental facility, and have any procedure done that they choose and they can use this card just like a debit card. They present it to the dentist office, a Visa card, by the way, it is a Visa, just make sure that the dentist accepts Visa. And they can utilize it over the counter for dental. So to me, this is probably one of the best dental plans on the market because, you know, you get to choose where you go. You can negotiate with that dentist. You can try to get a better deal, and then you can just go ahead and pay with your card. And that card's going to be loaded $250 a quarter. And that's not use it or lose it. So what that means is, you know, you get $250 the first quarter. You know what? I really don't need it. I haven't used it. Next quarter comes around, another $250. Now you're up to $500. Wow, I got $500 in there. Next quarter comes around, you're up to $750. You haven't used it yet. Last quarter comes around, you got $1,000 in there. Wow. Now you can say, hey, listen, I better either go find a problem with my teeth or I better go buy a lot of things because that last quarter is it. You do have to use it or lose it on that last quarter. But that's $1,000 that your member has just gotten back that year. So like I said, this is one of the things when you're out there, you know, because when I'm in sales, I always look at my client and I find out what their needs are and I fulfill their needs. So this is something that really stands out from the competition. This is something that there's going to be people out there that when you talk to them about this, they're going to love it. They're going to be all over it. This is what they're looking for. So this is one of the key features along with a couple of other things that I'll get into once I start discussing the plans. But keep this one in mind. This one is very special. Let's move on here. Non-emergency medical transportation. Here's another good one. This is another thing that we're kind of on the top of the list with among the other competitors. We have unlimited transportation. Not on all plans, but the plans that we do offer, it is unlimited. That is just fantastic. A lot of these other programs are limited. You get, you know, 12 visits or 12 transports a year, 20 whatever. We have unlimited. The vendor is Circulation, nation's largest manager of non-emergency medical transportation. All right. Benefits available varies by market and plan, of course. Circulation contracts with Lyft and other accredited transportation organizations to provide you rides. Key selling points here. Free rides when you need the most. Zero copay to approved locations. Let the member services schedule a ride for you, and you will have, all you have to do is make a call, okay? And here's a nice one. Bring a family member. Bring your caretaker. Bring a friend. They can go with you. You just can't pick up any hitchhikers on the way, but you can bring somebody with you, all right? But that's a big plus. I mean, listen, you know, anytime my kids or my wife has ever, you know, seeked any, I want to be there. I want to go with them, you know. So here gives the opportunity of whomever that person is with, they're more than welcome to come along for the ride and help them along on the visit. So this is fantastic, and it's unlimited. Big plus. This is another feature that you want to kind of keep on the top because there's a lot of seniors that can't drive anymore. There's a lot of seniors that don't have somebody that can give them a ride, and this is a beautiful selling point here for our product, the fact that it's unlimited. 50 miles and up to $100 per trip. It's not round trip, it's one way, so that's one way. Wheelchair accessible vehicles too. So if your client or your member is needs a wheelchair, well, they can bring that along with them also. So they're all set up for the transportation. It said unlimited. Keep that in your head. Very, very important. Meal services, and this is after you get out of a hospital stay. The vendor is GA Foods. GA Foods has been creating and delivering high-quality nutrition as well as well-balanced meals for over 45 years. So that's a little bit longer than what I've been in this industry, so they got me beat. Meals delivered within 48 hours of request. Basically, the way it works is they go ahead and put in their order. They after they get out of the hospital. But here are the key selling points: 14 to 56 meals provided, depending upon the plan. 16 plans include a meal benefit in 2021, and again, you'll see that when we go into the benefits. And anytime, listen, anytime, and I expect you to do this once you get on board with us, or even if you're not there yet, you got access to it. Always look at SOBs, always look at EOCs. That's the truth of these plans, and all these benefits are also included in those EOCs, and they'll give you the details, and that's really what you need to learn. You know, don't go at it from just a marketing surface level. When you're trying to learn these plans, you got to go a little bit deeper than that because, you know, you got to understand the plan. You can't just understand the sales points. You got to understand the plan, and that's going to make you so much better in front of that member, and you're going to be doing that member justice. So, but anyway, getting back to this, 16 plans included in meal benefits in 2021. All meals created and registered dietitians meet or exceed recommended daily allowances requirements. Here's a nice one. They got kosher. They got health or heart healthy. They got diabetic. So they even got choices within their meals of particular situations that may arise with your member. And how it works, again, member services. They contact member services. Member services will help them through the process, and they'll get them going ahead and set up on this. So this is just an overview, but remember, just to go here real quick, key elements here is OTC, and the other key element is, not that these other ones don't mean anything, but the OTC and the unlimited transportation, very, very important, because you're going to find when you look at the competitors and other people that are marketing MA out there, they don't have this, okay? So let me close out of this without trying to mess anything up. By the way, this is my first trial doing this with Justin. As far as this is why I look
doing great, Dan. Doing great.
Thanks, Justin. All right, so sneak peek. Here we go. All right, so let me just give you a little bit of an overview of Florida, and let me zoom in a little bit so that you can see this a little bit better. Okay, so we're in 5 markets in Florida. Basically, we're broken down by county, and that sets our perimeters as far as who's eligible and who's not. It's not so much by the zip code, but it is with the zip code within the county. So you can use the county as your perimeter as far as who you can market to and who doesn't qualify. But when you go into the broker portal, when you start your enrollment process, the first thing they're gonna ask you is your zip code. And if you've been doing this for a while, you realize that everything is based upon zip code. But getting back to this, so basically everything that you see in the blue is MA. Okay, so if I zoom in here, here are our markets. The first market is Volusia. Volusia is all market on its own. And by the way, Volusia right now is probably our strongest market that we have right now as far as sales. We're doing fantastic in Volusia. Secondary to Volusia, we got Seminole, Orange, Osceola, which is considered, and there's a little bit of tricky part here. Okay, so Volusia is a market. Volusia is a market. Seminole, Orange, and Osceola is another market, including Pasco. Let me take a step back. I'm so sorry. I just want to make this very clear because it's a little bit confusing.
Right.
Okay, so Volusia is a market. Then we have Seminole, Orange, Osceola, and Pasco. That's another market. And then we have Lake and Sumner. That's another market. And then in the south, we have Palm Beach. That's another market. And then Broward. That's another market. So here's 1, Volusia, Seminole, Orange, Osceola, 2, including Pasco. I keep leaving Pasco because they kind of jumped across the state. And then the other market is Lake and Sumner, Palm Beach, and Broward. Well, what I'm going to be discussing today is going to be Central Florida, which is Volusia, Lake, Sumner, Seminole, Orange, Osceola, and Pasco. And you'll see the breakdown once I get into the plans. And I'm sorry if I confused anybody at this point, but it's just a little difficult sometimes to explain that little jump across the state. All right, here we go. So here are the things, here's one of the things that we were just talking about, and here's the other thing that sets us aside. Our main features, what really stands out is the Part B give back on a PPO. That, again, is something that is extremely rare. In the state of Florida, I believe that there's one other carrier that has one plan that has a $50 give back on a PPO. Other than that, I don't know of any other one. But we have it on multiple plans, and we range anywhere from $50 give back per month all the way up to $80. That is huge. That is something that, like I said, it's very rare. You got to understand, PPOs are designed very, freedom of choice. You can go in and out of network, but along with that, if you're an individual and you're not utilizing the plans that much, and there's a lot of members out there like that. There's a lot of members, a lot of seniors that are, hey, listen, they're in good shape. They're really not on any meds. They're feeling good all the time. They exercise. They do the right things. And they have the Medicare Advantage as something in case they need it. It's not something that, they're using it all the time. So you approach this member in that situation and you say, hey, listen, not only do you have a plan that in case you need it, it's going to be there for you, you're going to have the freedom because you can go in or out of network. If you have to go to a specialty hospital somewhere else, God knows where, you'll also have protection for that. And along with that, Mr. Senior, we're going to give you, $50 back a month. We're going to give you $80 back a month. I mean, that's huge. That's $960 a year potentially that you can be giving that member back if they're not utilizing their plan. So why, if you're that type of member, why would you say no? And along with that, like I said, we got the healthy dollars. The healthy dollars, you'll see it on a couple of our PPOs when I start getting into this, but it's mostly on our HMO. And again, this is something $250 a quarter that they're going to be getting. Not only can they utilize it for the OTC, but they can utilize it for any dentist. So let's get into the plans themselves. This is the part. Well, let me Advent markets. In Central Florida, the care partner that we teamed up with is Advent Health, which is across Central Florida. They got a fantastic network. Over 20 hospitals, over 3,000 employed and affiliated physicians, large FFS population. For those of you that don't know what FFS is it's basically you're either got fee for service or you have what is known as capitated or fee for service is the physician gets compensated when you go see that physician. A managed care, they're compensated to keep you healthy and they're getting that money every month regardless, whatever they negotiate with the carrier. Fee for service is they're going to get compensated when you go to see them. So that's why it kind of rolls me into the next thing that I was going to say that is so important about our plans and makes us, again, so different, is that our HMOs are all open access. And the reason they are is because we are a fee for service. They don't have to go through a primary care physician each and every time that they have to pick up front. They can go to any primary care physician at any time. They can go to any specialist at any time, even within our HMOs. And I'll discuss that with you very soon. But that's the way this Advent Health is set up with us. So basically, as I said, they're very strong. They're good in the Orlando area. They're fantastic in the Volusia area. And when you start getting into the Pasco area, it's a little bit thinned out. We're working on that, but we're definitely improving our networks, and that's something that we're doing on a daily basis. We're constantly increasing the networks. Network expansion here, let me just give you a little comparison in Volusia, where, like I said, we're doing extremely well. These are just some of the competitors. Now, this is something that was done back in July 10th of 2020. And it's through Zealous of Network 360, an analytical analysis as far as, what the networks look like for the particular carriers. And you can see here that we're right there with everybody else. So carrier-wise, network-wise, as far as the providers, we're doing fantastic. All right, Volusia. Here's the benefits to sell in Volusia. Bright Advantage Plan B, PPO. That's the one with the rebate, $50 rebate. The HMO, that's the one with the OTC. And now we have something kind of special. We call it the Bright Advantage Health Dollars. It's kind of a hybrid between the give back and the OTC HMO. It's got the freedom of the PPO that they can go in and out of network, but it also has an OTC card with it. And again, as you can see here, with these plans, the preventive dental's in there, the routine hearing is in there, the annual vision, the fitness, the telehealth, worldwide emergency, that's all included in all these programs. And I'll go which each one individually here. I'll start with the PPO give back in Volusia. Now, this is Volusia. None of our plans are going to have a monthly premium. So that I'm not going to go over that again. Next time you see the slide, I'm not going to bring that up again. So no monthly premium on any of our plans. And again, all our plans are open access. You don't have to have permission from that primary to go see a specialist. Very important. And you got to keep hammering that when you're talking to that member, because that might be something really important to that member. They might want the freedom to make their own decisions and not have to rely on the primary to send them to a specialist. And a specialist of not even their choice. It's a specialist that primary is going to pick out. Maximum out of pocket with this particular PPO is $6,700, which is right in line with everybody. Here's something that we're very strong. PCP visits. You can see 0 and 0. What does that mean? 0 in network and 0 out of network. So you talk about, what kind of a network we have. We got a fantastic network. I mean, they can basically go out of network and still have a zero copay for that primary care. Specialist, 40 and 40, same thing. You go in network, you get 40. You go out of network, you pay 40. So, you know, this plan is, when you start comparing this plan to the other ones, you're going to realize what I'm telling you. You're going to see how this sticks out, and it's going to really stand out to that member. There's so many different ways that it's appealing to a member, and like I said, you'll realize that once you start, you know, start calling in, start working with Justin, and you'll really understand these plans. Like I said, this is just a very high-level quick look, and I'm really dragging this out, so let me speed up here. Most out-of-network services, 30%. Inpatient hospitalization, 235, days 1 through 6. After that, there's no more. Outpatient procedure, ambulatory center is 150. Hospital is 250. Comprehensive dental. Here's what we were talking about before. With this particular plan, it's not included, but for $19, they're more than happy to offer the plan with the dental plan with this program. OTC debit card, it's the PPO. We don't offer it with this PPO. Transportation is not offered with this PPO. The Part D, this is very strong, by the way. And if you see a $200 deductible, yeah, okay, that's sad. I mean, some plans have a deductible. You know, once they satisfy the deductible, you can see our tiers, 0, 20, 47, 125, and 0. Well, tiers 1 and 6, the two that sit at 0, 75 to 85% of the medications that are normally used fall under these categories. So 75 to 85% of the meds that your clients are going to be utilizing is going to fall under the zero copay. It's fantastic, all right? Once they satisfy that 200, they're done. And now, more than likely, the majority of the medications they're taking are going to fall into these two categories. But again, you'll be able to go in there, you'll be able to put in the medication, and when you go into the portal, and they'll tell you what tier they fall into. You read your EOC. It's also in the EOC. Now here's the hybrid, the Bright Advantage Health Dollars. This is the one that I was telling you about. That's kind of a little bit of a blend. They don't get the $50 Part B give back, but they do have an LTC card with this plan. So they have the freedom of the PPO to go in or out of network. Reasonable, $5,800 maximum out of pocket. Here's the beauty again. PCP 0 and 0. Specialist visits 25 and 25. That's in or out of network. That's fantastic. 225 per day. Days 1 through 5. Ambulatory center is 150. Hospital is 250. The comprehensive dental, they can add it on this plan. It's not included, but they can add it for $19. Bright Health Card, $250 a quarter. Remember, it's not use it or lose it. That gathers up throughout the year, and they're more than welcome to use that for any dentist for any dental procedure of their choice. Transportation is included, and it is unlimited because all our transportation is unlimited. So when you see transportation on our plans, it will be unlimited. The prescription card, a little bit stronger here, no deductible, and the copays are slightly lower, 0, 8, 47, 100, 33%, and then 0. But again, tiers 1 and 6, 0. Extremely important because the majority of the medication is going to fall there. And here is our HMO for that area. Said I was going to go over monthly premium, and I did it again. Maximum out of pocket, $34.50. That's low. That's a good deal. All right. PCP visit, 0. Specialist visit, 0. How can you go wrong, right? And guess what? They can go to the specialist when they want to go to the specialist. They don't need to call their PCP. They don't need to go do an appointment with the PCP. They just call up their specialist and they make their appointment and they go. And they pay nothing. Okay, so extremely, extremely strong. And I know that if you talk to members about this, they're going to love this plan. The fact that it's 0 and 0. And that's why we're doing so well in Volusia. Okay, because there's very little competition. And the Advent Health Network is the one that pretty much all the other vendors are using, all the other carriers are using. But we got these plans that are untouchable. Inpatient hospitalization, $100 per day, days 1 through 5. After that, you don't pay anything. Outpatient procedure, $75 for ambulatory, $75 for hospital. How can you go wrong with that, right? Comprehensive dental, hey, they can have it. They can add it on here. But guess what? They got their OTC card. So they already pretty much got $1,000 towards their dental procedure. So, hey, if they really, really wanted a lot of dental, then I guess they would add the $15. But, you know, that's their choice. But you would have to explain that and make it clear that their OTC card already does come with dental services on there. Transportation, unlimited. This plan has it all. No deductible on the scripts. Very low copay, 0, 8, 47, 100, 33%, and 0. And again, tiers 1 and 6, 0. So this is an extremely strong plan. Let's move on. I'm running out of time here. Central Florida, I'm gonna get right into the plan so you can understand it. This is going to be the Orange, Osceola, and Seminole, primarily the Orlando area, and Pasco, the one that I keep forgetting on the west side. Let's get right into it. Part B savings plan. This one is an $80 give back. Not 50, this is 80, okay, on the PPO. Maximum out of pocket, $6,700. Primary care visit, in-network or out, 0. Nothing. Specialist visit, $40 in-network, $40 out-of-network. You can't beat that. Most out-of-network services at 40%. I said they just decide not to use a network whatsoever, and they go outside, they're going to be paying 40%. And their stop loss is going to be $10,000. But hey, you know, that's what they want to do. At least they have that choice. Inpatient hospitalization, $295 a day, days 1 through 6. Outpatient procedure, ambulatory service, $150, hospital, $270. Comprehensive dental, they can add it. It's not included. The basic is included, just like I said, on all plans. But if they want the comprehensive, they would have to pay $19 a month. OTC is not here because it is the full-blown PPO. And the deductible, yes, there's a $400 deductible on the scripts. But again, tiers 1 and 6 are 0, and the copays are relatively low, $20, $47, and $100 for tiers 2 through 4, and then tier 5 is 25%. Let's go over to the hybrid that I call the Bright Advantage choice, which is the PPO. No give back on this PPO, but it does come with the OTC. The out-of-pocket on this one is $5,400 for in-network, $10,000 out-of-network. Primary, 0. Again, specialist, 2020. That's in or out. Maximum out-of-pocket, 40%. That's if they decide to go totally out-of-network. Inpatient hospital, say $250 a day, days 1 through 5. That's very strong. Outpatient procedure ambulatory center is $125. Hospital is $225. Comprehensive dental is included in this plan, and they do take a little bit of a hit on the OTC card. This one's only $75 a quarter, okay, instead of $250. So this plan here, there could be a unique individual out there, but I'll show you the next one that's coming along after this. The zero copay, the 0 deductible on the scripts, 0 on the 1 and 6 tier, and then you got 8, 47, 133. So these are the 2 PPOs that we offer in Central Florida, and here is the HMO. And again, if somebody's after the OTC card, this is the plan for them. If somebody's after the give back, definitely that PPO with the $80 give back, which I showed you on the previous page, that's for them. So this is for the member that really likes the OTC feature. And this plan here, maximum out of pocket, is only $3,400. Yes, it's an HMO. Yes, they got to stay in network. Yes, they don't have a network coverage, but it's self-referred. They can go from specialist to specialist. They can go from primary to primary. They don't have to follow what that primary care physician tells them that they have to go and tells them what they have to do. So basically, freedom of choice on this plan, which is key. It's so strong because you got the protection of an HMO, but you got the freedom of a PPO. Primary care, 0. Specialist, 0. In-hospital stay, $190, days 1 through 7. Outpatient procedure ambulatory service, $95. Hospital, $100. Comprehensive dental, they can add it on, but again, here's the OTC card, $250 a quarter, $1,000 a year. As you all know by now, they can use for the dental. Transportation is included, and again, since it's included, it's unlimited. And then no deductible on the scripts. Tiers 1 and 6 are 0, and then 5, 47, 133. So this encompasses Central Florida, which is everything except for Volusia and Lake and Sumner. The other counties that we're in, that's what this encompasses: Orange, Osceola, and Seminole. Okay. Lake and Sumner. This is one of our newest areas that we've just gotten into, and I'm going to get right into it because I'm out of time. Lake and Sumner. This is a $50 give back on the PPO, which you should know by now. We either do 50 or we do 80. This is a 50. Maximum out of pocket is $5,900. PCP 00. You're going to see that in a lot of our plans, pretty much most of our plans, which is really fantastic for them. And you're going to also see the 30. You see the 30/30 here for the specialist. Again, in network, out of network, the cost is going to be the same to that member. that's a fantastic feature, which really expands the concept of the network itself. Most out-of-network services after that, 40%, meaning that if they go out-of-network, they are going to pay 40% until they hit that $10,000. Inpatient hospitalization, $250 a day, 1 through 7. Ambulatory center, $250. Hospital, $275. Comprehensive dental is available for an additional $19. But again, remember that basic dental is included on all plans. OTC is not covered on this plan. Transportation is not covered on this plan. And the deductible for the script is $400. But again, tiers 1 and 6 are 0. In between, it's 20, 47, and 100, and then 25%. Then we move over to the HMO. The HMO, now we only got 2 plans available for Lake and Sumner. We don't have like the choices with a couple of the other areas where we have 2 PPOs, 1 HMO. This one in particular, it's 1 PPO, 1 HMO. The HMO is extremely strong here. The HMO is $3,400 maximum out of pocket, which is fantastic. 0 for your primary, that's fantastic. $10 for that specialist, and you don't need permission. The maximum out of pocket, out-of-network services is not covered. You're talking an HMO. Inpatient hospitalization, 195 days 1 through 7. After that, it's 0. Comprehensive dental on this plan is available, and they would have to pay $15 a month to get it. But again, right down below this one, here's your OTC card, full boat, $250 a quarter, and it's not use it or lose it, and they can use it for any dental procedure along with any OTC type purchase. Transportation is included, unlimited. So this HMO is very, very strong. If you look at this HMO with the other plans in the area that are being offered through other competitors, you're going to see how this stands out, especially with that OTC card. You got to drive that home. That's very important. The prescriptions are 0, so there's no deductible with this plan. It's 0 on 1 and 6, just like all the other plans, and then very low copays, 4, 47, 127. And I think that wraps it up. I'm sorry it took a little bit longer than usual. I kind of dragged out a little bit. Hopefully the next run will be a little bit quicker. But this is South Florida, which we're not going to get into today. I just wanted to kind of cover Central Florida because I think that's what we're kind of targeting right now with Justin and Health Plan Markets. So I'll leave it at that. Justin, I'm good. If you wanted to go ahead and open up to any questions or anything, or.
Well, I've got. I'm going to go ahead and finish up. I've got a little more to cover here. I'm going to go ahead and fix that. Give me 1 second.
Okay.
And I'm going to take over.
Yes, take control back.
No problem.
Kind of run away with things sometimes.
No, it's perfect. I'm going to go ahead and switch back to the presentation. And it's just the end here, guys, and thank you very much for your patience. Dan has a lot of information. It's really good information, and you need to know it in order to offer Bright Health. So, that's why they're one of the leading plans. So, you can see us okay, Dan? You can see the screen?
Oh, I can see it great.
Fantastic. Okay, so this is where we are right now. We are in the end of OEP. March 31st is coming up pretty quick. Our sales agents right now are doing follow-up. We've got retention and missed leads that we're working right now up until March 31st, and then we go into lock-in from April 1st until about September 30th. Now, we are open year-round, so we still stay busy with this, especially with the offerings that Bright Health has. We're going to be going after T65s, new to Medicare folks, new movers, and those types of folks. So it's imperative during the slower time, though, to get contracted now. Do not wait until September. You want to get certified and ready to sell for Bright Health during this time. And then once we jump into open enrollment, pre-AEP starts October 1st through October 14th. That's where our marketing begins, securing your book of business and locking in those new clients that already know that they're ready to enroll. And then AEP starts all over again on October 15th through December 7th, and we start the cycle all over again. So now's the time to get moving. We don't want to wait. We want to get contracted soon. So, in fact, those of you that decide to join us today, and the cutoff is midnight tonight, make your decision to join Health Plan Markets. I will be paying for the AHIP, $125 for your AHIP if you don't have your 2022 AHIP, which is going to be rolling out here in June. If you don't have it right now and you want to get your 2021 AHIP, I will go ahead and put money towards that at $125 to get you ready to start for Bright Health. Again, that deal expires tonight at midnight. All you got to do is shoot us an email or send us a text, a call, whatever the case might be. So if you're ready to go, ready to join Health Plan Markets, or if you have additional questions, you can give us a call. Jessica will be on standby. Just give us a call at 844-696-3975. Jessica will be there to help you answer any other questions and get you rolling. Pretty easy process there. So with that, if you need more information, you can always visit us at joinhpm.com, and we're glad to help out. So that's it for us. We've got a few more minutes here, so I'm going to open it up for questions. Let me go ahead and do that. So is there any? Let me see here. Unmute everybody. Is there any questions we can answer for both Dan or myself? All right, if there's no questions, I do want to say thanks for everybody for attending and listening in to our presentation today. Special thanks to Dan. Thank you, Dan, for being on here. We really appreciate your time and expertise in getting us ready to go for Bright Health.
Thank you, Justin, and thank you all the participants. Really appreciate you guys all being here.
All right, thanks, Dan.
Thank you.